Alright. Hello, my name is Mia Carell and I'm doing the health assessment for my RN BSN program. This is my participant here. Can you introduce yourself?
My name is Maggie Smith.
And what's your date of birth?
May 29th, 1999.
Alright, and before I conduct this health assessment video, I just want to make sure that I have your full consent to record this head to toe. Alright, perfect. Alright, and I just want to note that I did perform hand hygiene prior to this video, so we are ready to go. Alright, so I'm just going to do a general inspection of Maggie. She appears well dressed for the video. Her affect and mood is normal. She is calm. Her skin is warm and pink, as far as I can tell, which is perfect. Alright, now I'm going to start with a head and facial inspection. So I'm going to palpate Maggie's head for any abnormalities. And I do not feel any. There are no lumps. There's no infestations. Her hair is intact. It is brown and thick, which is normal findings. Now I'm going to check Maggie's facial sensation, which is cranial nerve 5. So I'm going to check with a something soft and something sharp. All right, can you close your eyes? Tell me if you feel this.
Yes. 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 Yes.
Okay, so Maggie's cranial nerve 5 sensation for soft is intact. Now I'm going to check for sharp.
Yes. 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 Yes.
Right, so Maggie's cranial nerve for sharp is intact. Alright, now I'm going to be checking cranial nerves 5 and 7 for facial expression. So Maggie, can you frown? Alright, can you smile? Okay. Can you raise your eyebrows? And then close your eyes. And I'm going to have you try to push it up against mine. Okay, good. So Maggie's cranial nerves are all intact with facial expression. Now I'm going to ask you to, can you clench your jaw? And I'm going to palpate your temporal and masseter, and they are both even bilaterally. There's no lumps and abnormalities, and her jaw is very strong, which is normal findings. Now I'm going to move on to Maggie's eyes. So I'm going to grab my pen light here, and I'm just going to do a general inspection first of Maggie's eyes. So her eyes are brown. It appears the pupils are even, but I'm going to look with my pen light. She has very long eyelashes, and her eyebrows are intact. I'm just going to run my fingers through. There's no skin breakdown noted. I'm going to look inside in her lacrimal apparatus bilaterally. They are pink. They are moist, which is normal findings. I'm going to look in her conjunctiva, pink. And Maggie has white sclera, which is normal. Her eyelashes are intact. Now I'm going to ask Maggie to follow a series of eye tests. First, I'm going to just shine my light in bilateral eyes just to check for corneal light and make sure both eyes are have pupils are equal, round, and reactive to light. Okay. So in both left and right eyes, Maggie's pupils are equal, round, and reactive to light, which tests cranial nerve 3. So that is intact and that is perfect. Now I'm going to do my extraocular movements test with my pen light. So I'm going to ask Maggie to track my pen light in all of the cardinal fields of vision. So just follow my pen light. So Maggie was able to follow my pen light in all of the cardinal fields, diagonally and laterally, which is normal findings. Now I'm going to make sure Maggie's eyes accommodate. So I'm going to ask her to look at my pen light and then ask her to look at something further away. So I'll do the staircase because it's further away from us. So can you look at my pen light? And then look at the steps. So Maggie's eyes, her pupils react according to when things are close and far away. So that is a normal finding. With the extraocular movements that test cranial nerves 3, 4, and 6, which are all intact. Now I'm going to get my ophthalmoscope, and I'm going to check Maggie's red light reflex. Red light reflex is intact in the left eye, and optic disc is intact in the left eye. In the right eye, red light reflex is intact and optic disc is intact. Alright, so that is all normal findings for Maggie's eyes, which is beautiful. Alright, now moving down to, I'm going to do Maggie's ears next. So I'm going to start by just assessing her general size and shape. So her ears appear symmetric bilaterally. The size and shape is appropriate for her facial structure. I'm going to start by palpating Maggie's pinna and her tragus bilaterally. Any pain?
No.
Any pain?
No.
Any pain?
No.
And any pain?
No.
Okay. Alright. So I am going to just inspect in her left ear first. Alright. Her tympanic membrane is gray and pearly, which is normal findings. Just a minimal amount of earwax noted, but that is okay. Now I'm going to look at her right ear. Tympanic membrane is gray and pearly, which is normal findings. Also a little bit of earwax in that ear as well. Alright, now I'm going to use my tuning fork and I'm going to perform the Weber test. I'm going to just strike this tuning fork and you're going to tell me whether you hear vibration in one ear greater than the other, or bilaterally you hear the vibration evenly, okay?
Bilaterally.
Okay, so she hears the vibration bilaterally, which is normal findings. Now I'm going to be doing the Rhine test and check for bone versus air conduction. So I'm going to do the same thing. Air and bone. Which do you
The
hear
first
more?
one.
Air. So air conduction is greater than bone, which is normal findings for the left ear. Now I'm going to be doing the same thing for the right ear. So air and bone, which do you hear more?
Air.
Okay, air. So air conduction is greater than bone conduction for the right ear as well, which is normal findings. Next, I'm going to be doing the whisper test for Maggie. So can you cover your your right ear, and I'm going to just whisper 2 words. Can you repeat those?
3 cookie.
Okay, good. All right. Now cover your left ear. I'm gonna whisper
Blue pattern.
Alright, so Maggie was able to successfully repeat the words that I asked her to repeat. So both ears have normal findings. She's able to have, good hearing acuity, which is cranial nerve 8, which is perfect. Next, I'm going to move on to Maggie's nose. I'm going to just inspect her nose is symmetrical. Size is appropriate for her face, which is lovely. I'm going to just palpate her nasal bridge, her soft tissue, lymph nodes, any tenderness. Any tenderness?
No.
Okay, good. Alright. Now, can you tilt your head back? I'm going to just make sure that her septum is not deviated and her turbinate is intact. Okay, good. Okay, bilateral nerves appear patent and normal. But I'm going to ask Maggie, can you just plug your left nair and blow out? Good. Same with the right. Okay, so she was able to blow out through bilateral nairs, which means they are both patent and open, which is a normal finding. I didn't see anything abnormal, no blockages in the nairs, which is lovely. Now I'm going to just test her sense of smell. So I'm going to grab something. And Maggie, can you close your eyes? And I'm going to ask you what you smell. Smell.
Vanilla.
Perfect. Okay. And this is a vanilla candle. So, Maggie says the smell is intact. Now I'm going to be checking Maggie's mouth. So upon general inspection, her lips are pink. And can you open up your mouth? Her buccal mucosa, she has a little bit of saliva, which is normal. Her tongue is pink and moist, which is normal as well. Can you stick out your tongue? And no swelling is noted to her tonsil area, which is good. And all of her teeth are intact. She doesn't have any crowns or cavities noted, which is good. First, I'm going to check out Maggie's tongue strength. So can you push your tongue against this cheek and resist me pushing it back in? Good. Same with this one. Good. Okay, so this tests cranial nerve 12 for tongue movement and tongue strength. So that is intact. Now I'm going to ask you to move your tongue from side to side and up and down. Okay, so Maggie's cranial nerve 12 is intact. Now I'm going to do a taste test for Maggie. So I'm going to give you 2 objects and you're going to tell me if they're sweet, salty, sour, or spicy, okay? Alright. Here is the first object. You can put it in your mouth if you want. I don't want to surprise you.
Sour.
Sour, good. That was a Sour Patch Kid. Okay, next one.
Salty.
Salty, yes, that was a chip. So Maggie's taste is intact, which is cranial nerve 7 and 9. Now I'm going to just check Maggie's gag reflex. First, you can swallow. Wash it down with some water. By swallowing, we are also checking cranial nerves 9 and 10. So that is intact as well. Okay, can you stick out your tongue? I'm going to check Maggie's gag reflex. Okay, so Maggie's gag reflex is intact. Okay, so that is it for the mouth. So now I'm moving on to neck. Upon general inspection, Maggie's trachea is not deviated. It is midline. Her neck and its size is normal for her body structure. I'm just going to palpate your carotid. Pulse. +2. +2, which is normal. I'm just going to palpate your lymph nodes for any swelling, anything like that. Any pain?
No.
Okay, no swelling noted to Maggie's lymph nodes. Now I'm going to auscultate your carotid. No bruit, no thrill. Stand this way. No bruit and no thrill. Now I'm going to auscultate Maggie's thyroid. Okay, no bruit and no thrill, which is all normal findings. Next we're going to do a series of heart tests. So I'm going to grab my stethoscope and I'm going to listen to Maggie's heart sounds. Oh, you know what? I'm sorry. Wait, we should do chest first. I'm going to auscultate Maggie's chest, her lungs, posteriorly. So can you turn around? So posterior, we're going to check for thoracic expansion. So can you take a deep breath? Okay, so expands evenly bilaterally. Now I'm going to just auscultate Maggie's breath sounds in all fields in the posterior. Deep breath. Deep breath. Deep breath. Okay, lung sounds are clear, so that is normal findings. Now I'm going to just test tactile fremitus by asking her to say 99 as I move my arms down her spinal column.
99, 99, 99, 99.
Okay, so I felt vibration evenly throughout her spinal column when she said 99, which is normal findings. Next, I'm just going to percuss. Okay, there was no hyperresonance, no excessive dullness, and when I percuss, I didn't hear anything abnormal. All right, Maggie, you can turn to the front. Now I'm going to just assess Maggie's respiratory rate and pattern. Her respiratory rate is regular. She has unlabored breathing, and her respiratory rate is normal for her age, which is lovely. Now I'm just going to auscultate her breath sounds in the front. Deep breath. Okay. Any general like shortness of breath when you're doing that?
No.
Okay, perfect. Now I'm just going to palpate. Any tenderness?
No.
No. Okay, good. Alright. So Maggie's lungs in the back and the front were clear. No pain on palpitation, and the tactile firmness test was normal. Now I'm just going to assess Maggie's heart. So I'm going to start by listening to her apical, pulmonic, Erb's point, tricuspid, and mitral valve, all of the heart points. Okay, so Maggie's heart sounds are normal. There is no murmur noted, so that is great. Now I'm just going to check pulses. So I already did carotid, but I'll do it again for the purpose of the heart. +2, +2. We'll do brachial. +2, +2 on the right. Radial. +2, +2. Femoral, I won't do for right now. I'll do popliteal. +2. Posterior tib. Penis. Alright. So all of her pulses are +2 and normal, which is beautiful. Now I'll ask you if you can just raise up your neck. I'm going to check for jugular venous distension. Alright, and then turn your neck. No jugular venous distension noted, which is normal. I'm going to ask Maggie to lay down on the couch, and I'll just assess and listen to her aortic arteries as well. Okay, so can you pull your shirt up? Okay. So now I'm going to listen to her aortic. Alright, no bruit and no thrill, which is normal. Renal. No bruit and no thrill. Iliac. No bruit and no thrill. And femoral. No bruit and no thrill. Just gonna palpate the arteries. Okay. Next, I'm going to move on to abdomen assessment since Maggie is laying here just like this. Upon general inspection, her abdomen is rounded, it is soft, it's not distended, which is great. I'm just going to start off by auscultating all of the quadrants. So Maggie has present bowel sounds in all of the quadrants. Then I'm going to do light and deep palpation. Any pain?
No.
So light and now deep.
No.
Any pain? Okay, good. There's no peristalsis noted. She does not have any pain, which is normal findings. You can sit up. Okay, you can come back over to the chair. Now I'm going to be doing upper, let me move my camera, sorry. Is that good? Okay. Now I'm going to be looking at upper and lower extremities. I just forgot to note Maggie's skin in her stomach was normal. There was no skin breakdown. There hasn't been any skin breakdown noted so far in this video as well. So I'm gonna just check Maggie's upper extremities. So beginning with your neck, I'm just gonna palpate. Any pain?
No.
Any pain here?
No.
Okay, so our general palpation, no pain. Can you just raise up your shoulders against my hands? Okay, great. Okay, good. So that checks for CN11, so the sternocleidomastoid and trapezius, that cranial nerve is intact, so that is great. Maggie, I'm gonna have you just roll your neck. Check for neck range of motion. Good. Roll your shoulders back. Good. And then can you just flex your biceps? Good. Wrists, rotate. Fingers. Good. Alright, good. Now I'm going to check a series of, we can do strength tests and then I'm going to do the reflexes. So strength, you already did your shoulders. So now I'm going to have you hold your arms out and just don't let me push your arms down. Good. Strength is +5 bilaterally. Now grip. +5 strength bilaterally for Maggie's grips as well. Now I'm going to be doing a series of reflex tests for the upper extremities. So Maggie, I'm going to first test your brachioradialis reflex. So I'm going to go right here. You can rest. Okay, Maggie's fingers did flick inwards, so that is a positive test. Next, I'm going to check over here. Maggie's fingers flicked inwards a little bit here. Let me try to switch hands. Okay, so she has positive brachioradialis reflex. Now I'm going to check her brachial reflex on the left hand. Relax. So her arm did rotate up a little bit, which is positive. Here. Her arm rotated up as well. Okay, so her arm did reflex up a little bit, which is great. Now I'm going to check her tricep reflex, so relax your arm here. Good. Alright. So we're checking to make sure her arm moves outward a little bit. Okay, good. And on this side. Okay, good. So her arms moved outward bilaterally, which is great. And Maggie also has, I don't know if I noted, +2 radial pulses as well. So Maggie's upper extremities are all intact, strong, and all of her reflexes are present, which is great. So now I'm going to move on to Maggie's lower extremities. So Maggie's hips and knees. I'm just going to start by general palpation, and you let me know if you're in any sort of pain. Palpate hips. Any pain?
No.
Knees? Any
No.
pain? Okay, good. Alright. So I'm going to check your patellar reflex first. So just try to dangle your legs a little bit.
Can you move your camera?
Yeah, I'm gonna move my camera down. Alright. 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 So Maggie's leg kind of swung outwards, which is positive. Alright. Same with the left and right legs, both have positive patellar reflexes. Now I'm going to test her Achilles reflex. So Maggie's foot kind of went upwards for her Achilles on the left foot, which is normal. Maggie's foot went upwards for the Achilles tendon on the right foot, which is normal as well. Now, if you can just put your foot here. Now Maggie's toes curled inwards, which is normal findings for the plantar reflex. Sorry. She's really ticklish. Hold on. Maggie's legs curl upwards for that one too, which is normal findings for that one as well. So I'm going to put this one back. So the plantar reflex, Achilles reflex, patellar reflexes are all intact. So next, I'm going to have you stand up and I'm going to check out your spine. You can just turn like this way. Yeah. Come over here. Oh, yeah. So I'm first just going to palpate Maggie's spine. Any pain?
No.
So now we're going to check range of motion. I'm going to ask you just to bend over. Can you stand up? Can you bend over this way? Touch your toes? Okay. Any pain?
No.
Okay, good. So Maggie has like full range of motion of her spine. She is very flexible, which is great. You can sit back down. I'm just gonna run back through all of the cranial nerves that we tested during this video so far. So cranial nerve 1 was Maggie's sense of smell. She was able to smell the vanilla candle. Cranial nerve 2 was optic fields. She was able to look in all of the cardinal fields of vision, and her acuity is intact. Cranial nerves 3, 4, and 6 were the extraocular motor movements of her eyes, which were intact as well. Cranial nerve 5 was her facial sensation and the masseter and temporal when I palpated. She was able to feel the cotton swab and the sharp touch. And cranial nerve 7 was her facial expressions that she was able to do and her facial movement. Cranial nerve 8 was her hearing acuity. She was able to hear my whisper test. Cranial nerves 9 and 10 were her swallow and her gag reflex, which were both present. Cranial nerves 11 was her sternocleidomastoid. She was able to resist against my touch. And lastly, cranial nerve 12 was her tongue movement, side to side, up and down. Next, last test we're going to do is we're going to test your rapid movement of your hands. So can you just do this back and forth? Good. And you do heel to shin with your right, heel to shin with your left. Okay, good. That means Maggie has good sensation. I'm going to ask you to do a series of walking. So I can record you this way. I'm going to have you just walk straight away from the camera. Can you walk on your heels? Good. Now walk back on your toes. Now can you walk heel to toe? Okay, good. Now I'm going to check while you're standing there. I'm going to check for Romberg sign and for pronator drift. So for Romberg sign, just stand there with your arms together and close your eyes. So Maggie is not swaying at all, so that means she does not have a positive Romberg sign. So that is a normal finding. And then can you hold out your arms? Good. So neither of her arms drift at all, so she does not have any pronator drift. All right. So you can come back to seated. So Maggie's gait was even for all of the walking, heel to shin test, sorry, not heel to shin, heel to toe test and everything like that. And she's steady. She had negative Rombergs and pronator drift test as well. So now I'm just going to test Maggie's exteroceptive sensation. So I'm going to check for her superficial pain sensation and temperature. So can you close your eyes? And I'm going to use something sharp and make sure she can feel the pain sensation.
Yes. Yes.
Okay, good. And then just tell me if something is hot or cold.
Cold. Hot. Cold. Cold.
Okay, good. All right, she's going to do that. All right. Then I'm just going to check, I'm going to check for, to make sure that Maggie can feel vibration. So can you put out your hands? And just tell me when you start to feel the vibration and stop feeling it.
Feeling it.
Sorry.
Feeling it. Accept. Feeling it. It's stopped.
Alright, perfect. Alright, so now I'm going to also have you identify an object with your eyes closed. So close your eyes and let me know what this object is. Open up your palm.
A fork.
Alright, good. So Maggie was able to identify the fork, which is diagnosis, which is great. Now I'm going to write something in your palm with your eyes closed. So let me know what letter or number I'm writing.
D.
Okay.
3.
Okay, so Maggie was able to identify that I wrote D and 3 in both of her hands, which is a normal finding for graphesthesia, which we were testing for. And I believe that is it. Oh, 2-point discrimination. So I'm going to use both of these forks and we're going to check and make sure that Maggie can feel when I'm doing 2 points or just 1 point on her body. So use your arm, close your eyes, tell me if this is 1 or 2 points.
2.
Good. Same with this one. 1 or 2 points.
2.
Alright, good. And then, can you feel me touching here? How over here? Okay, so Maggie does not have extinction either. She feels both sensations bilaterally, which is normal findings. I believe that concludes all of our testing for today. Maggie was able to have normal proprioception, corticosensation, and exterosensation. Her eye movements were regular, her lung sounds were clear, her heart sounds were regular, pulses were +2, all of her cranial nerves were intact, and that concludes our head to toe. Thank you.